Hi, I'm Dr. Don Teeter, and I would like to speak to you for a few minutes about central sensitization. Central sensitization is the current theory of how many people experience chronic pain, and it's critical to understand this concept, to understand your clients who have chronic pain. I speak frequently with the medical community on this topic, and many physicians who are treating pain have never even heard of this. It is a relatively new concept, but it is clearly the current scientific theory, and it does make a lot of sense. So to understand central sensitization, it is important to understand normal pain first. So we have pain for a reason. Pain serves a purpose. The purpose of pain is to warn us of danger or to warn us when there's a problem so that we can take appropriate action. You think of conditions where people lose the ability to feel pain, and there are bad outcomes because of that. Think in particular of diabetic neuropathy, where you lose the feeling in your feet and legs. That is now one of the leading causes for amputation in the United States, is people with diabetic neuropathy because of the loss of pain. These folks will get a sore or an ulceration on their foot. It'll become infected, but because they never feel it, they don't pay attention to it, and the infection spreads until they finally need amputation. So pain does clearly serve a purpose. It gives us warning. But just to feel pain in and of itself is not helpful. Our brain must learn how to interpret that pain. And our brain does interpret that pain and helps us know how to respond to it. So the way normal pain works is, say I pinch my finger. That pain signal, that inflammation from the pain will activate a nerve called a nociceptor nerve. The nociceptor nerve will travel from the area of pain all the way to my spinal column. In the spinal column, it makes another connection to the spinothalamic nerve. That carries it up to the base of the brain to an area called the thalamus. Now, the thalamus is like a 911 center. It distributes that signal to all the areas of the brain that need to know about it. Because, again, just to feel pain in itself would be suffering. It would just be pain. But we need to know how to interpret that. So it sends it to various areas of our brain, like the amygdala. Our amygdala is our fear center. It helps us know how afraid we should be of this and how we should respond to it. It'll send to our hippocampus. Our hippocampus is responsible for making and retrieving memories. So it'll help us understand from past experiences whether this is a pain that we need to worry about. It sends it to our limbic system. That's our emotion center. So if we're doing something where we are having great fun, say we're playing ball with our family and we have an injury to our toe, we stub our toe, we don't feel it much because that pain is not important to us at that time, but later it may be. On the other hand, if we have a lot of anxiety and depression because of a lot of things going on, we do feel that pain a lot more. That pain is magnified. The signal is also sent from the thalamus to our frontal cortex. That's the area where we have rational thinking and we interpret the data and we make a rational decision on how important that is. So all of these areas then provide feedback to the thalamus and to the other area of the brain called the somatosensory cortex. Now, the somatosensory cortex is the area where we actually feel the pain. So when those nerves fire in the somatosensory cortex, we physically feel the pain wherever that pain originated. But the other areas of the brain, our amygdala, our hippocampus, our limbic system, our frontal cortex, many other areas, these provide both a positive and a negative feedback to that signal to either magnify the activation of the somatosensory cortex or to diminish it. So these other areas are like volume knobs. They turn up the volume on the pain or they turn it down. So times when we have pain that's just not important to us, that volume is turned down and we don't feel it as much. Times when it is important to us, that volume is turned up and we pay particular attention to it. So that volume is important. Central sensitization is when people have chronic pain and that system has gone wrong. So what we see is that, like the amygdala, our fear center, sends this signal to the somatosensory cortex to magnify whatever pain we're feeling. So we may have chronic low back pain, we have some arthritis in our back. Normally that may be a fairly mild signal to our brain where we have just some discomfort. But the amygdala, if it's kicking in, it's turning that signal way up, so the pain is felt much more severely. And I want to make it very clear, the pain is not imagined. The pain really does happen, and the severity of the pain is directly related to the input from these other areas of the brain. So our hippocampus, it might bring back bad memories from the past. and magnify the pain. Our frontal cortex, where we worry and where we catastrophize, that'll get us thinking, well, this is just going to get worse and worse. That magnifies that signal. So in central sensitization, you have all these areas magnifying that signal and increasing the pain that we feel. There's some diseases where central sensitization might be the entire cause of the pain. Fibromyalgia, we think that there's very little or no input from the tissues themselves, but it's the fear that we experience, it's the anxiety that we experience, it's our catastrophizing and negative thoughts that actually make us physically hurt. So chronic back pain is an area where many people have a significant amount of central sensitization, and that pain signal is greatly magnified, and at times even it may not originate in the back. There was recently a large study done and published in the Journal of the American Medical Association, where they had people with chronic back pain that had gone on for a while. They gave them usual care, the pain persisted, and they did a procedure called radiofrequency nerve ablation, where they actually go into the back and they kill the pain fibers. They kill those nociceptor fibers that sense the pain and start that signal to the brain. The interesting thing was they found after doing this, and they did it for 300 people, they had 300 other people that did not receive the treatment but got usual treatment, and they found that 3 months later the pain was no better in the people that had that treatment. And the reason for that is because these areas of their brain are sending signals to their somatosensory cortex, activating those nerves so they physically feel the pain in their back, but it's not even originating there. So that's kind of a brief explanation of central sensitization. Not everybody with chronic pain has it, but probably most people who really suffer from their pain do have a significant amount of central sensitization. It may be on top of other neuropathic pain or nociceptive pain from arthritis or something, but the central sensitization is what really magnifies it and causes people to suffer. They've actually done some neuroimaging, some functional magnetic some functional MRIs on people's brain, and they show how these systems are working, about how they're activating that somatosensory cortex, and how really the wiring or the system of the brain has been it's been changed in a way where people feel more pain. So the thing about this now is, as we think about this, is that for, say, those people with chronic back pain that have a significant amount of central sensitization, we can give them all the medications in the world, but it's not going to help, because the problem is really a neurologic problem with the wiring of the brain. So we give them non-steroidal anti-inflammatory medications like ibuprofen, which is an anti-inflammatory, and those help maybe just a little bit if there's some arthritis in the back, but in many people it doesn't help at all. It's been shown that acetaminophen or Tylenol does not help people with chronic back pain, and again, it's because the pain is not located in the back where this medication is working. Opioids are a specific problem, because the way they work in the brain on these systems, they ultimately end up magnifying that signal even more. So people with central sensitization probably should not be on the opioid pain medications, and it'll probably not only have very little effect, but it won't help. It'll make them worse. So the interesting thing now that we're seeing with the neuroimaging by the functional MRIs is that certain behavioral techniques, in particular cognitive behavioral therapy and mindfulness training, can actually fix those broken pathways in the brain. They actually rewire the brain to make it so it works more normally and reduce pain. So it's very fascinating. We have these folks with chronic pain going to me and other doctors wanting relief from their pain. We're doing all these procedures, injecting joints, doing spinal injections, doing all these different treatments, when in fact the real treatment needs to be the rewiring of the brain that can only be done in the behavioral therapist office. So as we think about this, and as we think about central sensitization, again, remember, this pain is not imagined. It's very seriously felt. It's the activation of the somatosensory cortex in the brain. But the answer lies not so much with the doctors in my office, but they lie in your office, where you do these counseling techniques that rewire the brain. CBT changes the wiring, so they're no longer catastrophizing. They're no longer thinking about this. They consciously use areas of the brain that strengthens those ties and diminishes that positive feedback to the brain, and it does significantly reduce pain. Mindfulness does the same thing. Again, by not concentrating on their pain, by getting their thoughts off of their pain, their brain changes, and it actually fixes them. So neurologists can't do this, neurosurgeons can't do this, but behavioral therapists can. You all are instrumental in people with central sensitization in turning them from being victims into victors. You turn them from being people suffering from chronic pain to being people who are victorious in life but living with chronic pain. And that can be just a dramatic, life-changing effect for people. Thank you.